Hello, we are in Nursing 410, Research and Evidence-Based Practice in Nursing. We will be giving a presentation on our evidence-based practice poster here. Our topic is telemonitoring and hospital admission and heart failure. Our group members are Sharon, Carrie, Sydney, Will, and Zishan. To get started, I'm going to talk about the background of our poster and the research that we've done. So patients with heart failure have higher hospitalization rates. Continuity of care and regular follow-ups are essential to their nursing and healthcare. Although telehealth monitoring is promising, its effectiveness remains a subject of debate. The next topic we're going to talk about is the purpose, and Carrie is going to take that over.
Thank you, Sydney. So the purpose of our presentation is to address high hospitalization rates in heart failure patients. The use of telehealth monitoring may help decrease this. This led to our PICO question, which is, in heart failure patients, what is the effect of telehealth monitoring compared with usual care on hospitalization? We did a thorough review of the literature to see if this topic has been studied. These are the methods that we used. The databases we searched in were PubMed and CINAHL. The keywords that we focused on were heart failure, readmission, telehealth, and hospitalization. The inclusion criteria, we looked at articles where the people were over the age of 18, so adults who had high risk conditions. The exclusion criteria was anyone under the age of 18. We wanted studies that have been published in the past 10 years, so we did not use any studies that were older than 10 years. We also limited the search to just English studies or articles. For the analysis, the articles we summarized and compared were regarding their hospital admissions and readmissions. Sharon will now present the results.
Thank you, Carrie. As she said, my name is Sharon, and I will be doing a presentation on the results. So, based on our database, all studies were quantitative. We have 3 interventional and 2 observational designs. One study included high-risk patients other than those with heart failure. We have the outcomes were either admission or readmission rate. Most studies found that telemonitoring significantly reduced the rate of hospitalization. I'm going to hand it over to William to do the discussion presentation. Thank you.
All right, thank you. So as for a discussion, the compelling evidence supports telehealth monitoring as an intervention to help monitor patients with heart failure and reduce their hospitalization risks. Nurses should integrate it into nursing care. The project limitation consists of one study involving high-risk conditions, wide-ranging levels of evidence, and various telehealth monitoring approaches. Despite these limitations, the consistent trend towards reduced readmissions highlights telehealth monitoring's potential value in chronic disease management. Future research should aim to standardize telehealth monitoring protocols and include larger, more diverse populations to strengthen the generalizability of findings. And then I'll hand it over to Zishan for the conclusion.
Okay, thank you, Will. So we have seen that heart failure is a chronic, ongoing problem across the country, even across the globe, with a high risk of mortality if it's not monitored on an outpatient basis. Given the large global scale and a lot of underserved areas in the United States, telemonitoring is a very significantly helpful tool in monitoring these patients. Providers can distantly monitor patients and address any complications with patients that have heart failure. So conclusively, we can see all these results show that telehealth monitoring can reduce hospital readmission in such patients with heart failure. So nurses, healthcare providers, and cardiologists should offer telemonitoring to patients if it's appropriate. However, further studies should investigate the benefit of telemonitoring in patients that also have high-risk conditions. Thank you very much. This concludes our presentation.